horrors of kidney failure. It's a disease that affects your whole body, even your mind. You know, so when I had the opportunity of going to India for my surgery, the surgery was performed by Dr. Rajiv Sood, very experienced surgeon. Dr. Sood has done more than 3,000 kidney transplants.
Wow.
Apart from other surgeries. So, whilst I was recovering, it occurred to me, why can't I get this gentleman to come to Ghana and perform surgeries, kidney transplants in Ghana? Because kidney disease is almost at epidemic levels in Ghana now. And people die, they drop dead almost every day from kidney. So I spoke to Dr. Sood, who has become a close friend of mine. And he said, well, I don't know, but let's see how it goes. I said, okay, fine. So when I returned to Ghana, I toured almost all the big hospitals, asking whether a transplant could be done in their facility. But there was a lot of red tape, hospital politics, just name it. So it has taken about 6 years for us finally to have the first 2 surgeries here. There was a third one, a lady, but she has some other problems that must be solved first.
Before the surgery
before the surgery. And so that is my short story.
Well, a very good one, because it's you'd agree that it's not often the case that people who are, seeking to find solutions to their own problems would start thinking about how this could benefit other people. And I like the fact that, it's taken 6 years and to cut through the red tape, but we're here now. Dr. Rajiv Sood is on the line with us all the way from India. Dr. Rajiv Sood, congratulations on the successful renal transplants here in Ghana. But of course, it's not new to you, having done more than 3,000 of those. Would you share with us, when, Mr. Chichimaika proposed the idea of renal transplant in Ghana, what was the first thing that you thought about? Right. I think you may need to unmute yourself so we can hear you. Okay, so I think that Dr. Sood is just in the process of unmuting himself, and then we can have a clear line to him. Just shout hello if once you unmute, and then we can confirm over here. No, I can hear I can see your lips move. I think you're saying good morning, but we can't hear you yet. So we'll have the technicians work on that with you to make it work. But Dr. Sood is joining us via Zoom, and we're going to be talking to him in a minute. But we have a rep from Marengo Asia Hospitals, Mr. Mohammed Akalak. Good morning, and thank you very much for joining us.
Good morning. Thanks for inviting us.
Right. Congratulations to everyone who made this possible. Let's talk about how this whole thing came together. First, starts with a conversation between Mr. Chichimaika and Dr. Sood. But I'm sure that it didn't, that was not all. Of course, a lot of things had to be done, and cutting through the red tape. What was it like working with all the stakeholders to make this possible?
As we say, Rome was not built in a day. So it took 6 years to perform the first surgery by an Indian doctor in Ghana. So, of course, the idea of calling doctor from India to Ghana came from Mr. Tichimaika. And he's like a fatherly figure for me. And I was his coordinator at that time in India. So we started contacting people, and of course, after a lot of struggle, we find the place, and finally we performed 2 surgeries. First one was on 4th of July, and second was on 5th of July, 2023. And the hospital was Korlebu. Both surgery went very well. Patients are stable. In fact, I came to know both donors got discharged. Day before yesterday. So that is a good news and a big achievement for all of us.
I totally agree with you on that. And when we talk to Dr. Sood, we'll learn a thing or two more. But I just really want to, who are some of the, of course, you would have to work with the Ghana Health Service on this. Who were some of the key stakeholders you worked with to make this happen?
As you know, I'm representing Madingo Asia Hospitals from India. And there is not a one person who contributed, who can be the sole champion of the project. So everybody from India, there are a lot of people. Of course, I can not name everybody, not possible. But from your embassy and from your local doctors, your nephrologists, of course, the infrastructure that so in the hospital, your hospitals, buildings, even the nursing staff, everybody contributed in that project. So it is not the joy for us, it is joy for everybody.
That's correct.
So it is like a friendship between India and Ghana.
And that friendship goes many, 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 many years, and long may that continue. Evidently, the two countries can be, we could easily refer to each other as brotherly nations. We have quite a lot in common.
We always say Ghana and India. They are culturally and historically same. They share a lot of things. And we believe and we work with the motto, each one teach one. So if we have something, why can't we teach to our brother state? So for this motto, we are in Ghana and not only doing the surgery, but to sharing the knowledge. So in near future, the surgeries can be done only by Ghanaian doctors solely.
Wonderful.
So that's the motive.
Each one, teach one. Fantastic. We now have Dr. Rajiv Sood on the line. Dr. Rajiv Sood, good morning, and thank you very much for making time for us this morning.
Good morning and greetings to all of you from Delhi, India. It's a pleasure being on your show.
And congratulations to you. Like I said earlier, I mean, you have more than 3,000 renal transplants under your belt, but these two must feel special considering you've had to do this outside of your regular environment. What was your first thought when Mr. Tichimaika suggested that we could be doing this in Ghana?
So I must admit that I am partial towards Ghana because the Ghanaians are such wonderful people. I have so many friends and I have traveled often enough. So yes, for me, kidney transplantation is a passion, the joy of seeing a person who was not well, who was rather sick, then getting better, recovering, indeed in itself brings a lot of joy. Needless to say that it is not an individual effort, so it's congratulations to all of us, including the doctors and the paramedical staff and the administrators in your country who have supported this venture. And the task of doing a kidney transplant involves a patient, a donor, a legal clearance, so as also the infrastructure in the hospital to do it, the expertise. So I'm very happy to say that Ghana has made rapid strides in the last 6 years, and Korlebu is going to set up a specialized unit to address issues of kidney transplant patients. So I am quite confident that going forward, we would be working together more and more. And soft skill sharing and enhancement would happen along the journey.
Fantastic. You mentioned that, for kidney transplantation to occur, of course, you need a donor and a patient, and then the legal environment to make it possible, and the infrastructure. I must say that from the little I've read, India has a far more advanced medical infrastructure compared to Ghana, at least as far as the renal health is concerned. What was it like working here in Ghana?
So, most kidney failure patients are on dialysis and continue on dialysis till they can undergo a transplant. To do a transplant, you need 2 specialized theaters, and after that, for the period of hospitalization of the patient, an isolation room, and intensive critical care support in the form of critical care experts and anesthesiologists, as also the parent nephrologist. So I must say that compliments to the doctors at Cordoba. They could put together all this, and also a surgical team which supported me in carrying out these 2 surgeries successfully. It was indeed a pleasure, though I have operated in Ghana in the past at other hospitals, and the experience has been very pleasant, very positive. The staff is very enthusiastic, keen to learn. The doctors are competent. So, as such, whatever were my apprehensions when I set about doing the first case, but the whole process and the outcomes were rather satisfying. And as such, I am hugely confident that we can take on bigger surgical challenges jointly and bring the care to the doorstep of the patients as against having them travel to India.
Now, we're here at Asaase Broadcasting Company. We have a foundation, the Asaase Foundation, and over the last 3 years, we've been championing, kidney health. And we've recently acquired and donated 11 dialysis machines. I think a total that we've given so far in AI about 14. We started with the first 3, right?
Yes, I think we've received something like roughly 16 in total,
Right.
and we have, in this last tranche, we distributed 7,
Right.
or announced distribution of 7, and in fact, I believe installation work has just been completed in Sunyani for the one that's going into the second machine we've donated to the Buna Regional Hospital.
That's right.
In Sunyani.
Now, the reason I bring this up is that, the kidney disease burden is on a sharp rise in Ghana. Dr. Sood, I would just like, for the purposes of education, for you to give us a sense of what are the underlying causes or potential causes of kidney failure, and so that we can all understand this, because quite often when you hear about organ failure or renal failure in anybody, you sort of tend to think, oh, that's something that happens to a certain kind of people, but the more you become exposed to it, I'm learning that it's no respecter of persons. So a bit of education would be appreciated.
So, just as our body ages with time, the organs also age with time. God gives us 2 kidneys. When 70% of those kidneys are damaged, the person steps into what we commonly call kidney failure. When 85% of the kidneys are damaged, the patient needs either dialysis or kidney transplant, otherwise life is not compatible, and a person can have a cardiac event or the lungs can fill with water and life would be no more. Well, all organs need a healthy blood flow, a blood supply. So if a person is a smoker, then the blood flow to various organs gets compromised. So smoking is a very significant adverse trait. If the person is a smoker, kidney function can be severely affected. Additional diseases like hypertension, diabetes, they lead to premature aging or affliction of the organs leading to kidney failure, certain kind of dietary habits, excessive indulgence in salty foods, they also adversely impact kidney function. Then conditions like kidney stones or urine infections, if happening repeatedly and untreated, can compromise kidney function, leading on to what we call end-stage kidney disease, at which point 85% is gone and the person has to be hooked onto a dialysis machine till such time he or she can find a suitable donor and undergo a kidney transplant.
Wonderful. Now, evidently, your success here in Ghana, in the preliminary stages, if I could call it that, is green. Both the patients and the donors are all stable. The donors have been told by Mohammed that they've been, discharged from the hospital, and the patients are stable. But Mr. Techimaika, you are a living testimony of Dr. Sood's work. What was life for you like before the surgery?
I had no life. I couldn't pursue my profession. I couldn't do anything. Most of the time I was in bed or on the dialysis machine. It's a terrible, terrible, terrible condition. You are cut off from, society, more or less. I used to travel to Europe, to the US, Canada, almost every 3-4 months. When I got sick, I just couldn't make the trips. You have no life when your kidney fails. And I don't wish this condition on my worst enemy.
Wow. But evidently, 6 years on, you had a kidney transplant.
6 years ago.
6 years ago, yeah. So you've had the transplant, and what's your post-surgery experience?
I mean, you come back to normal life. You can do whatever you used to do before you got sick. There are a few things that you have to avoid, like in most other conditions. Cut off alcohol, salt, and a few of such, Now you will be on medication for the rest of your life, on certain medications. Dr. Sood put it in a very interesting way. He said, when you have a kidney transplant, the kidney wakes up and says, what am I doing here? This is not my usual place. And then the donor's body also will say, but where is my other part? And so it goes like that. But generally, you must take all the medications that have been prescribed so that the body does not reject the kidney. And once you follow the doctor's instructions, have regular tests to make sure that the kidney is working well, you are as good as anybody who has never had the disease.
Wow.
Yes, I just wanted to ask you, Mr. Techimaika, you spoke about being on medication even post-transplant. One of the things that has made kidney care prohibitively expensive for patients in Ghana is the cost of, obviously, the dialysis treatments, the availability being another thing altogether, and the cost of medication. How does the cost of medication post-transplant compare to what you had to fork out before you had your operation?
You know, in India, it is not expensive. The medications are affordable. Mm-hmm. I was in the United States for a year seeking to have a transplant done. Dialysis in the United States costs $700 a session.
$700.
$700. And you have to do this 3 times a week.
Oh, gosh.
In India, they charge $18,000. But now it's even come down. It's now $15,000. In the U.S., the patient was to pay $150,000, and the donor is to pay $100,000.
So basically $250,000.
Exactly, just for the transplant. No medications, nothing, just the transplant. The doctor moves a good kidney and puts into you. That's it. In my case, I couldn't even do it in the United States because all my siblings there were rejected for one reason or the other. So I came back home after spending about a year in the United States. And then somebody suggested to me that, why don't you try India? Because they've advanced in this technology. So I made the necessary arrangements. In fact, when I got the invoice from the hospital, I thought they had made a mistake. Because $250,000 as against 18,000, which I paid. I mean, there has to be some mistake.
That's a drastic drop in the cost.
So I asked them. They said, "Yeah, that's the price." You know, in America, the medication that you have to take cost almost about $3,000 a month. Here, it's nowhere near that. It's absolutely, and Mohammed has been buying my medications for me, so probably he can give you better detail about the price. But I want to talk about the advantages apart from the cost. The advantages of having your transplant in Ghana. One, the environment is this India's environment and Ghana are not the same. There are certain cultural differences, so many other factors. But to go to India, you have to sit in an aeroplane, and that costs money. And you don't go alone. You go with your donor, and you go with a caregiver, somebody who will look after you. You know, when you come out of the surgery, your family members are around you, your wife, and all that. So psychologically, it's a very pleasant situation. I didn't have advantage of that. but I was very well looked after by Mohammed and Co. whilst I was there. You don't have to rent a place to stay. You don't have to even buy food for yourself because your wife or your cook can bring you food in the hospital. So there's everything to say for having the transplant in your own country, in your own environment, with family around you. You know, that for me, that is the best, apart from the cost, the psychological factor, you know, and that aids healing faster. You know.
Wonderful. Well, if you just joined us, it's 48 minutes past 8 on the Asaase Breakfast Show, and we're talking to three gentlemen, and we're, you know, really looking at the possibility of developing Ghana into a kidney transplant hub after the successful transplant, two transplants that were done sometime, was it 2 weeks ago?
The 4th and the 5th of July.
4th and the 5th. Oh, just last week, actually. 4th and the 5th of July. And Dr. Rajiv Sood is the chairman of the kidney transplant unit at Maringo Asia Hospitals in India. And Mohammed Akalak is the representative of the hospital who's here in the studio with us. And Mr. Inde Techi Maika is a successful kidney transplant patient. And Mohammed, you know, I'm thinking at this point that we've had these two successful surgeries. Hopefully we can have more. But the cost differential leaves me to wonder whether, you know, there's something that we can learn from India as far as renal health and renal transplantation is concerned.
So basically you are asking me about the cost differences between getting transplant done in India and getting
anywhere else in the world. I mean, from $250,000 to $18,000. And then also the cost of the medication.
Yes.
I know you have a really good pharmaceutical industry.
Yes.
So in the spirit of each one teach one, is there any way that we can scale this achievement up to a point where the overall cost of not just the transplantation but also the medication that you need to take afterwards would be affordable to many in this country?
Yes, of course. Let me tell you first of all about the cost of transplant in India and the Ghana. So it is difficult to say exact amount right now, but yes, I can give an idea. The cost for the transplant in Ghana is about between $20,000 to $25,000.
Okay.
And if you compare the cost, because in India it is $15,000. Apart from that, if you want, or not you, but somebody wants to get the transplant done in India, they need to buy the tickets for the patient, donor, and the attendant. Plus, stay in India about 2 to 3 months. The cost of the living and the food. So, if we compare with all these, elements, the cost of the transplant in Ghana is much cheaper than the cost in India, because in India, people are going from Ghana to India to get their transplant done. So you just count 10 people are going there for the surgeries. Contrary, in Ghana, 2 doctors or 3 people are coming to operate 10 people or 20 people. That can be any number. So logistic wise is feasible. So our suggestion, get transplant done in Ghana. Trust your doctors, they are quite capable. You have very good infrastructure, and we are not here only just to do the surgeries. We are here just to share the knowledge also. And I would say, why can't we make Ghana as a medical hub? Now everybody is looking for the cheaper treatment and coming to India for the cheaper treatment. Why can't people from nearby countries can come to Ghana and get their treatment done? We have everything here. I have been coming Ghana, it's almost 6-7 years. So you can call me half Ghanaian. I'm more interested to work in Ghana than India. So it is just like giving back to Ghana now.
That's right. There's one thing that I always use to judge or to guess how well assimilated anyone who's non-Ghanaian is. When you do the handshake, when you do this click at the end of it. No, Mohammed did it.
He's got it down.
No, he's got it down to the T. And that's when I was like, I said to him, how long have you been coming to Ghana? So I've been here quite a bit. I was like, well, I could tell, But Dr. Sood, this is brilliant news all round, and the idea of a transplantation hub or a medical hub in Ghana, and I don't know how well you know this, but we have a lot of people coming into the country for various medical procedures to be done from Liberia, Sierra Leone, Togo, Benin,
across
the
region,
West African
and
region.
even further afield.
Exactly. And so, this could still prove to be a very cost-effective approach to dealing with kidney transplantation issues for people beyond Ghana. What do you think it's required on this side to make this possible, Dr. Sood?
So I'll give you an example that the last patient that I sent to America was about 30 years ago. Thereafter, the local infrastructure in India, the confidence that the patients had on the doctors and the infrastructure was an ongoing process. And today, nobody heads out to the west from India for medical treatment. Similarly, whatever is happening or has started in Ghana today, if I say that kidney transplantation is one program that we are talking about, it would be an ongoing journey where the results, the outcomes will bring about a level of confidence in the patients, in the Ghanaians, as also the news would spread, and possibly it would be more convenient for the nearby African country nationalities to travel to Ghana than to take a 13, 14-hour flight to India. So surely what we achieved today is a small step. It would need that the program is nurtured, the results are good, and a positive messaging goes out. And I'm sure Ghana would also get to a point where nobody would want to leave Ghana for treatment and everything else would be available in your own country.
So for a lot of things like this to work, evidently there's a framework, the ministry, the health service. What steps have been taken so far to beyond this intervention to align with our Ministry of Health to ensure that this small but giant step that has been taken through the two surgeries will manifest in an end game, as you described, that people would no longer leave.
So I am told that there is a proposal with your government to lay down laws around organ transplantation, and it is possible that some laws around it would be enacted in a short span of time. So that would bring about a clarity in terms of who can donate and a comfort for doctors like me who travel into a different country. There are concerns of medical legal issues. So if there are proper laid down guidelines, as also licensing of centers for carrying out these procedures, it would help in making the whole program a structured activity. Today, in isolation, there was infrastructure, the skill was brought under that roof. There were hospital ethics committees who screened the donor and the recipient for the suitability of the person donating, that there is no malpractice that is going on. So currently, it is happening in isolation all these activities, and as we move forward, they would get integrated, and that in itself would bring about a lot of confidence amongst the average citizen and the patients that the kidney transplantation program in Ghana is a structured activity, and there is a level of accreditation about the center and the facilities and the infrastructure. So it's an ongoing journey, but today the point we wanted to prove by doing these two cases or going forward, that it is highly achievable, doable with comparable outcomes. And so I think there's a great joy around it, and which is where each one of us, which means you and Tachi Michael and Mohammed and all the many, many doctors of Kolebu and some of the other private hospitals who've been supporting us, I think it's credit to every single individual.
Yes, I wanted to ask both of you, Dr. Sood and Mohammed Akalak, because of course with the Marengo Asia hospitals in Faridabad and Gurugram, as you said, this is something that has been worked up to a fine art, and you have all the infrastructure in place. Fortunately, to do these two surgeries recently on the 4th and 5th of July at Kolebu, you were at our premier teaching hospital in this country, and as you said, all the procedures were thoroughly scrutinized by officials involved from the point of view of ethics, supporting medical staff and so on. You carried out both operations early this month using living donors. Another thing that perhaps people might be thinking about is, what are the storage facilities like for people looking for organ transplants? When you went to Kolebu Teaching Hospital, Mr. Aklak, did you find that what you needed to do was a very quick donation and immediate transplant because there aren't the storage facilities for organs, or are there the beginnings of that kind of infrastructure at Kolebu?
I think Dr. can answer this question.
I will take this question. So when we talk of organs being, kidneys specifically, being made available to patients who need the kidneys, there are two parallel programs. One is a live related donation, and the other is a cadaver donation. By cadaver donation, we do not mean somebody who's dead for a while, but somebody who's brain dead. That means the organs are working, the heart, the lungs are working, but the brain is damaged beyond a point where the brain related activities and reflexes are over. Now, in your country, in Ghana, there is no cadaver program as yet, because you need a lot of laws around certification of the person as a brain dead individual and organ harvesting to happen. So that is not an option. So the organs can only be donated by a living person. And so that there is no trade of organs, the general laws that are there, whether unwritten or written as in your country, is a relative, which means a blood relative, or an emotionally related person, as in a spouse or the in-laws who are invested in that relationship. So when it comes to blood relatives, we talk of first degree, which is mother, father, brother, sister, son, daughter, or second degrees like uncle, auntie, nephew, and so on and so forth. As far as the kidney harvesting and attaching it to a patient or a recipient's body, once the kidney is removed, we cool it to below 4 degrees or close to 0 degrees, and that reduces the metabolic processes in the cells of the kidney, and thereby the oxygen need goes down, thereby the organ can survive without a blood circulation for a period of time. So a harvested kidney in a live related donor is reconnected to a blood supply within 25 to 30 minutes. However, this cooled kidney can be left cooled in a box for periods of 12 to 24 hours and then transported or connected to another body. But that situation classically arises in cadaver donations, where the organs are harvested and transported across distance or cities. So the 12 to 24 hours factor bringing about organ availability.
Right.
Have I addressed most of your concerns?
That answers the question very fully, but perhaps Mr. Akalaki wanted to comment about the provision of facilities or availability of facilities at Kolebu.
Yes, I would like to add just one line that Kolebu has everything. I mean, as I said earlier, we have very good infrastructure, and there is just a matter of taking a step forward. And like we have started the 2 surgeries, and in near future we are also planning more in association with local doctors. And our plan was 1 week every month for Ghana. That was our plan. So we are also requesting all stakeholders to come forward and take the initiative. And not only Accra, why can't we plan in Kumasi or other provinces? So the health should be for all. So it should be everybody should have the equal right to get the good health. So we are for that.
Great stuff.
Absolutely, I think that answers the question very fully, and one
definitely
hopes
does.
one goes to, or one soon gets to the point where, as you say, we see far more access to interventions of this sort across the country, so that people can have the wonderful health that we see here of Mr. Tichimaika. A wonderful thing to see.
Well, it's a very, very wonderful story, and we're super glad that we got to hear it from all 3 of you, and congratulations to all the various individuals and institutions that worked and collaborated to make this happen. Dr. Sood, I want to come to you for a final time, this time to just tips for kidney health to our audience who are listening to us, things they ought to do to ensure that they have a healthy kidney. I believe a transplant is the last resort, but prevention, as we know, is better than cure.
So I'll quickly answer this question by prefacing it that oftentimes a kidney donor asks me, what would happen to me after I donate 1 kidney? And I would like to share with you that there is a study which showed that a kidney donor lives longer than a person with 2 kidneys. Now you would consider this very strange. God has given us 2 kidneys. Here is a person who's donated 1 kidney, and you're telling me that he lives longer than somebody with 2 kidneys. So what changes in this kidney donor after donating 1 kidney is the realization that it is very important to look after your health. And one very basic factor which takes us all down is when we gain weight. Obesity works against the body and leads to all kinds of diseases and illnesses. So a kidney donor, after donating 1 kidney, becomes aware, follows a healthy lifestyle, and strangely may end up living longer than somebody who's overweight, who's stressed out for so many other reasons, career, ambition, who in turn starts smoking and drinking. So we don't realize, who doesn't exercise. So all these factors which we take for granted as good health cannot be taken for granted. You have to work to keeping this machinery working efficiently, just as you look after a car that gets older by being that much kinder Similarly, you have to take care of your health as you journey along. So, more than one specific thing is whatever is commonsensical, from hygiene uh, to other practices, avoiding excessive intake of certain type of products which may lead on to stone formation, avoiding excessive salt which may lead on to hypertension, being overweight and overindulgent in sugars, which may lead on to diabetes. So, all these factors, there are some categories which are unfortunate where a congenital condition in the kidney, like called polycystic disease of the kidney, those are congenital factors. You cannot change them. That progression would lead on to end stage kidney failure. But there are 95% of conditions which could well be contained by a healthy lifestyle, by a disciplined individual. I think that's the key message. Discipline, be disciplined about your life and about your health.
Thank you very much indeed. We must be disciplined to live a healthy life. Any final words from you, Mohammed?
Yes, of course. I would say every day, we are discovering new things. So I would say India is not far from Ghana. Now we have a facility of telemedicine. If patient is sitting here and has been transplanted by Dr. Sood or by anyone, patient can consult or always consult through the telemedicine, can take doctor's opinion rather than going there and spending a lot of money. So the motive is health should not be the burden on somebody's pocket. So everybody should can access the health facilities freely, and it should be for everybody. So that's a motive. So similar thing we can do in Ghana, like sitting doctors in Accra, they can consult their patients through the telemedicine in remote area of Ghana. So we are not far, we are always there, and like we spent 10-15 years to change the scenario in India, we are in Ghana, and we request everybody to join our hands and change the situation here.
Absolutely. And final words from you, Mr. Techimaika.
I like to advise people with kidney disease that if you are on dialysis, for example, the amount of money you pay for dialysis, in 2 years, you would have covered the cost of a transplant. Now, the thing is also that without the transplant, you will certainly die over a period of time. People die even on the dialysis machines, So people shouldn't be afraid of a transplant. You are handled by very competent doctors, both in India and in Ghana. And so people should be willing, and it's not as expensive as in other parts of the world. So there is also the issue of donors. People are afraid to donate. But those fears are not justified. You live a better life with one kidney, because those people with one kidney are usually more careful, And I pray to God that this initiative will progress, and we have many more people. We can save many more lives in Ghana.
Wonderful. Well, I'd like to thank you very much for taking time to share your story with us, and this success story, which is, as you call it, a small step, but a giant leap into changing the story of kidney transplants in Ghana. I'd like to thank you, Dr.
I would like
Rajiv.
to add last line.
Yeah, okay, sure.
The total cost of the kidney transplant is always lesser than what you spend in 2 years of time on dialysis.
Okay.
In Ghana, I have done small research on it. Person is paying 500 CDs on a single dialysis, plus some medication, some injections are there, which is costing about 400 CDs. So about 900 CDs on a single day the person is spending. Now you can calculate if somebody is taking 2 dialysis in a week, that means 8 dialysis in a month. So what will be in 2 years time? So the transplant cost is lesser than that.
I agree. Thank you, and for all of that. Thank you, Dr. Rajiv Sood, Chairman of the Kidney Transplant Unit at Marengo Asia Hospital in India. Thanks very much for your time. Also to Mohammed Akalak, representative of Marengo Asia Hospitals, and to Mr. Eden Techimaika, who is a successful kidney transplant patient and the man whose desire to see more people benefit from the care he got led us down this path that's starting something great for this nation. You're all wonderful people, and we thank you for your time this morning.
Thank you very much.
Thank you for having us.
Great. We're going to take a break, and when we come back, we'll go into another conversation. We'll be talking to Chen Hini Boating, who, have just done a special report, a documentary for BBC focusing on what's been happening in the Volta region. And the documentary, which was published a few days ago, is titled, what was it again, Anaya? Is it The Night They Took Our Children? Yeah, it says The Night They Came for Our Children. And that's the one. So we're taking that break now. We'll come back with more. Stay with us.
If you get LPG, let me see your hand. Mr. Menu, I'm not happy with you, cry.